My name is Sarah, and I go to Davis-Elkins College in the nursing program, getting my bachelor's degree. And I have a research proposal for staffing. Thank you for coming. All right, there are two issues with staffing at this facility right now, and one of them is the nursing shortage, and the other one is retaining staff. This problem was identified through the quality improvement process with past research concerning safe staff to patient ratios. RNs are quitting, and we're not hiring any new ones. Travel agencies, some of them are refusing to send anyone because they feel the nurse to patient ratio isn't safe. And overworking night shift is leading to burnout. The employer does recognize the problem. There's been offered incentives, a $1,000 bonus to any nurse that can recruit another nurse. And then there's been a $1,000 incentive for any nurse from day shift to go to night shift. Unfortunately, neither one of these are working. No one has volunteered to go to night shift. And any of the new nurses that are recruited, once they get here, the startup pay is just not high enough for them. They're not accepting the job. All right, and the CNAs, they're also quitting, but there's no incentives being given for them. One thing though that is helping is the night shift nurse one of the night shift nurses is now charge nurse, and she doesn't take patients. She actually helps the other nurses. So that is a big step that helps a lot. This is literature supporting the concepts within the study. I have numerous articles that I went through, and basically all of them are on safe staffing and why it's good to have RNs. One of them was the article In Pursuit of Safe Staffing. And it talks about when hospitals became a business, what they did is they started cutting their budget. The budget cuts, though, were nurses, and they started bringing in unskilled, unlicensed personnel. And it was causing deteriorating working conditions. The nurses that were still here were getting really burnt out. Another article was nurses say understaffing causes deaths. The current nurse to patient ratio suggests it's not only unsafe for the nurse, but it's unsafe for the patients. There was a survey done with 600 nurses, registered nurses, and I've got some percentages here. 87% of nurses reporting having too many patients to care for. 67% report an increase in medication errors. 64% report an increase in complications. And 54% report readmission of patients, all due to problem with understaffing. So see, there is literature to support staffing issues and how you should have more RNs on the floor. One of the articles I picked was a magic solution for all staffing ills. And this one basically says, they went and they asked RNs what we thought, could fix things. And 3 things that they said were more support for the nurses who stay, nurse-only staffing, and fewer meetings, more patient care. And then the last one that I chose was the United Front may help prevent crisis. It discusses the staff shortage in nursing homes and home health care after the patient is discharged from the hospital. Basically what it's saying is there's not enough RNs after they get out of the hospital to take care of them. And then it makes the readmit rates really high, and then the hospital eats the cost. Participants in the study. The best participants in the study would be the patients and the staff nurses on the units. Also, management would be good. You got to go through management and get approval for the study through management. I will personally ask 10 patients to take a survey, a voluntary survey, and I'll also personally ask 10 staff nurses to take a voluntary survey. The study will take approximately 5 weeks from start to finish. Is it going to be a descriptive study? A descriptive study is one in which information is collected without changing the environment. A descriptive study can provide information about the natural occurring health status, behavior, attitudes, and other characteristics of a particular group. Descriptive studies can involve a one-time interaction with groups of people, also called a cross-sectional study. I will be using a one-time interaction with groups of people. I'll be gathering data that includes the attitudes of a particular group. The survey, the cross-sectional study, and the attitude characteristics are all examples of a descriptive study and will be used in my research proposal. Is it going to be a quantitative study? Well, a quantitative study has variables that can be measured in numbers. Basically, anything that has a number, blood pressure, pulse, those are examples. There will be numerical values used in the proposal, but because the questions are basically opinions, they're not measurable in numbers alone, so it is not quantitative. When I gather the surveys, the number of surveys completed will be statistically significant. The survey instrument used will be a Likert scale that only has 5 options, but the options, like I said, are opinions and carry no physical number. Is it going to be a qualitative study? Qualitative research uses language, concepts, and words rather than numbers to produce evidence. It is collected data that cannot be actually measured or is not numerical. Examples are physical traits like color and gender, patient's perception of care, or quality of care. I'm going to ask the participants to take the survey. The questions being asked are opinions of the participants, which makes it a qualitative survey. In conclusion, there are going to be elements of each, the descriptive, the qualitative, and the quantitative that I'm going to be using in the study. And lastly, how will the study influence evidence-based practice? Well, once the study is cleared by management, and I can go on with it, the evidence afterwards can be given to them, and then it'll be really helpful in determining how to address the staffing issue. The evidence could show whether the patients are affected by the staffing problem. The evidence could show if the staffing problem is fixable. And the study will collect data to be used as evidence. And that's it. Thank you very much for coming.